Guys, this is John Adamson, the Rehab and Documentation Guru, and today I'm going to urge you to stop cranking the heck out of your acute and subacute total knee patients. So it's bugged me for many years. One of the first jobs I had while in therapy school was working for a total joint registry. We collected data for research on total joint replacements. This was back in the late 80s. And it has always bothered me, and I've participated because I was stupid, when therapists take an acute or subacute patient post-total knee replacement who under anesthesia was able to achieve probably 125 degrees of knee flexion and cranked that knee to the point where the patient's like screaming or jumping out of their seat, 8 to 10 out of 10 pain, just to get a few degrees of range of motion. And that makes absolutely no sense, because there's no way mechanically, no way physiologically that patient lost that range. So you see them one day post-op. They got 125 degrees of knee flexion while under anesthesia, when the joint was already closed up, and then now post-op day one, they're hugely swollen, and you're getting 78 degrees or whatever you're getting. And you're thinking, wow, this patient needs to be stretched, and I'm going to push them to get that last few degrees so I can report to the physician, oh yeah, we're getting 90 degrees of knee flexion before they discharge. And that's a bunch of hogwash. That joint has an effusion, it's swollen, and there's no way mechanically you're going to get that thing to stretch without killing the patient from a pain perspective. It's all about edema management. And so anyway, this is just my little rant, because I'm working now in a setting where we get a lot of orthopedic patients, and there's such a push on the range of motion more than the edema. But which came first, the chicken or the egg? And in this case, the edema is coming before the loss of range of motion. You control the edema, you get the range of motion back. And that's how you have to approach it. So please do not crank the heck out of your ortho total knee patients. If they're chronic, if they've healed already, if the effusion's out of the joint and they're still lacking range, well, maybe we need to crank some and work on some more aggressive stretching and do some mobilizations at that point, but not before. Anyway, this has been John Adamson, the Rehab and Documentation Guru, going on a little bit of an orthopedic rehab rant, and hopefully bringing light to some concerns that even you've seen in the practice of, in this case, physical therapy. Anyway, have a great day. God bless and take care.